out, then I'm gonna pan back and I'll get some tight shots of this stuff. Okay? Thank you. Pardon me?
So they start back up.
They got rejected by the aliens. Shot them back.
Sure.
Okay, they're aware of it, the truck. And 7 minutes.
Cool, thanks. I would not be to ambush you guys with that camera shot change, but. All right.
Like 10 seconds of each one. You cut them in if you want.
Oh, wait,
We'll get them right after the governor walks out the door.
perfect, thank you. I'll tell them to keep rolling.
It'll get better.
Doing Spanish translation. I'm afraid it will mess me up.
I'm used to seeing you over there.
Andrew, I'm gonna run up and do a quick mic check at the podium for someone who's watching our live stream.
Sure. Do you want to be seen?
No.
Okay.
Podium mic check, podium mic check. 1 2 1 2. Podium mic check.
Okay, we'll go ahead and get this started this morning, and of course, we'll start with an update on the numbers. Today, we had 257 new positive cases for a total of 3,159 positive cases. We have no new counties to report, so we have still 82 total counties in the state of Iowa. We have 1,013 negative cases today for a total of 22,661 negative tests. The State Hygienic Lab has 7,556 tests available. We have 1,235 Iowans that have recovered for a recovery rate of 39%. I am very sorry to have to report that we did have 4 additional deaths for a total of 79 deaths. And again, 48% of all deaths in Iowa are among residents in long-term care facilities. Across all of the RMCC regions yesterday, there were 214 COVID-19 patients hospitalized. 23 were admitted in the last 24 hours. 91 patients are being treated in ICUs, and 58 are on ventilators. Also, in hospitals across the state, there are 4,402 inpatient beds, 552 ICU beds, and 691 ventilators that are available for patient care. And just as a reminder again, for more information, including a breakdown of data by region, go to coronavirus.iowa.gov. We had an additional, we had one at Iowa Premium National Beef, which is in Tama County. And I'm sure Iowans also saw our case count climb significantly. And I just want to point out that 261, or 67% of the 389 positive cases that were reported on Sunday can be attributed to the fact that we are doing surveillance testing that's being conducted at the meat processing facilities, and those were included in those numbers. We will continue to see clusters of positive cases in these types of facilities because COVID-19 spread quickly and easily among people in close supply will be impacted. So we're going to continue to do, we must do our part to keep them open in a safe and responsible way. The Department of Public Health is working closely with our long-term care facilities and our food processors that are experiencing not only a decrease in attendance or when employees have tested positive. By identifying potential issues early, they can deploy a strike team to conduct even more surveillance testing, contact tracing, to understand the virus activity, identify and isolate people who are sick, and implement, where possible, or if they have an additional mitigation efforts to slow the spread and protect the at the Iowa Medical and Classification Center had tested positive for COVID-19, and this is the first positive case identified in any of Iowa's correctional facilities. The Department of Corrections was proactive early on by implementing significant mitigation measures as soon as Iowa's first COVID-19 cases were identified, and Director Skinner and her team have continued to take the situation seriously and responsibly. I've asked Director Skinner to join me today to provide an overview of what the Department of Corrections is doing to mitigate the spread of the virus in facilities, as well as really helping us provide our workforce with the PPE that they need to be safe. So with that, I'll have Director Skinner.
Thank you, Governor Reynolds. It is an honor to be here today. Thank you for your great leadership during this time and all the support and care you are giving Iowans. This past month has been inspiring to see Iowans coming together for the greater good. I have no doubt that we will be stronger and a better state when we get through this pandemic. I'm here today to share with you 4 areas to focus on to mitigate the spread in the prison population. March 1st, our population was 8,495. And lastly, the production of PPEs for relevant entities through SEOC. So currently we are providing information and guidance on our website. We have daily calls with community-based corrections directors, wardens, and central office incident command. During those calls, we give updates, guidance, strategies, and they share their needs of how best to protect their staff and those under their supervision. Additionally, we are standing up 2 phone lines specific to COVID-19 starting today for both staff and the public. Both numbers will be on our website. As of today, in our institutions, we have 1 positive inmate, 2 positive staff. We have tested 103 inmates. We have a few pending tests at this time. We found out this morning that another member of our staff that works at IMCC tested positive for COVID-19. Our hearts are with this member of our team and hope they recover soon. But the good news for the facility is that this team member has not been to work since April 9th. Yet this is another example of how high traffic areas or possibly contaminated areas. We've also been doing strategies around prevention of spread between facilities. It's been identified as hazard revocations. Next, I'd like to talk about Iowa prison industries and some of the PPEs that have over the course of the month. So showing on. So today we're going to start with the masks. We've made 62,000
as well as warehouses. How to prevent transmission at the workplace. Incident event. For example, when it's necessary to protect the health of the public, we'll also.
Governor, are you considering an executive?
All of the Tyson and kind of how we walk through keeping them up and running, even on a, maybe not at 100% capacity, but even if it's at 50% capacity, it's important because this isn't regular. Shut it down for 2 weeks. We have farmers that are raising hogs. We are the largest hog producer in the country. Supply is about 25 million a year. And so if we aren't able to move them through the process, at some point, we're going to have to be talking about euthanizing hog. We're not that far from it, and it will be devastating, not only for the food supply, but for the cost of food going forward. And so we need to be thinking about all of that, and we need everybody to see how we can actually come up with solutions and really mitigate as much as we can through this pandemic.
Long-term care is in the meatpacking industry. So a question about each year. On the long-term care, it's my understanding yesterday the Trump administration is requiring more reporting so that in these LTCs, if you just have one reported case, the states now have to report that. Is that your understanding, and are you now doing that?
We have been so proactive. I'll let Sarah talk about that. But again, we are working with the healthcare facilities. We 444 long-term care facilities across the state. And so all along, we've really tried to put mitigation efforts in place. And I'll let Sarah talk about what we're doing even on top of what
A number of cases to the federal government. We continue to work with our federal partners, and they have a number of requests for information, and so we work and communicate with them every day to make sure that we can provide information that meets their needs. In the state of Iowa, we've determined that an outbreak in a long-term care facility is 3.
Done what it takes here. How is it possible then that you have so many people getting sick? Because as you know, some of the workers are saying the PPEs and the other protection were brought in too late, and that the initial contact happened, started to spread, and then they moved in. Is that your understanding, or what's your take of how this happened?
Well, they're mass gatherings. When you think about these, so it's all about control practices and really working with the facilities to make sure that they're doing everything that they can. But it's also making sure that the workforce knows that you need to practice social distancing. If somebody in your household is sick, that you're staying home. That you're
meat processing facility, people are working close together, and so I think that what we're learning is confirming we've heard in terms of the efficiency of the virus in some of these sort of settings. I think the other thing that we have learned through some of the surveillance testing is that because we're testing an entire workforce, we do find positive cases in people who might not be experiencing symptoms. And so the guidance about staying home when you're seeing other people, then you should be considering the use of PPE, which
so Iowans should think that so many